morning, everybody. Today I've chosen to tell you a little bit of what I know about cellulitis. I will discuss what cellulitis is and how it can occur. I will also share some research, legitimate medical information, and my own personal experience and thoughts pertaining to the onset of this disease, and measures a person can take to recover from cellulitis and prevent further damage with better self-care and other resources. This topic is a close personal one for me, and I'd like to share some of that with you as well. In an article from the Journal of Family Practice, cellulitis is defined as an infection of the deep dermal and subcutaneous layers of the skin. So pretty much just a skin infection, to break it down into normal English. Cellulitis has become increasingly common in recent years, with both incidences and hospitalization rates rising. Cellulitis occurs when bacteria enters the dermis through breaks in the skin barrier, such as an improperly cared for cut or wound. It can be very common among IV drug users. Another term I'd like to share with you is the definition of sepsis. According to the MedlinePlus.gov online encyclopedia, sepsis is considered to be your body's overactive and extreme response to an infection. Sepsis can result from an existing infection not being properly treated. With prolonged sepsis, tissue damage and organ failure can occur, even death. We know that everyone's skin has many types of bacteria living on it at any given time. With the definitions I've provided here, it's not hard to kind of imagine the infection of cellulitis. For example, you have a cut or a burn on your hand. If left untreated or improperly treated, this could then become infected and bacteria enters the bloodstream, causing increased infection. Supposing that this increased infection also continues to be left untreated, then sepsis is likely to become a reality. The Center for Disease Control website lists some common symptoms of cellulitis, such as redness of the skin or swelling of the affected area. These tend to be more visible to the naked eye, and doctors can just typically diagnose cellulitis with a physical exam or visual exam. In some cases, an abscess may also form, or there can be warm skin, pain, and tenderness when the skin is touched. Antibiotics are usually required to treat cellulitis and may be given orally or through an IV. However, in serious cases of severe infection, hospitalization is usually necessary. Most cases of cellulitis resolve quickly with treatment, although some can spread to the bloodstream and become life-threatening with the sepsis happening. Okay, so as previously mentioned, untreated infections can lead to sepsis. The Center for Disease Control lists some symptoms of sepsis to include confusion, disorientation, extreme pain or discomfort, cold, clammy, or sweaty skin. It is imperative to get medical treatment right away if you think you might have sepsis. A more thorough examination would be done, including blood work and x-rays to see where the infection is. And sepsis can be hard to diagnose because it will sometimes mimic symptoms of other diseases, so they can't always find it right away in the body. And then medical treatment just includes, again, antibiotics, fluids, oxygen, maintaining blood flow to certain organs, and then treating the source of the infection. My reason for choosing this topic is pretty personal. Next month it will be 5-year anniversary of the day I found out that my shoulder, I don't have any bone here, I got cellulitis, I have these cracks in my fingers, and I was doing a lot of drugs back then with my ex-husband. When I smoke, these cracks in my fingers open, and kind of like, I don't know, then the doctor said whatever bacteria was on my hand already got into my blood that way, and it dissolved my shoulder bone, like it decomposed or putrefaction, it's some gross words. But I can't feel in this arm from a surgery I had back in 1993, and so I didn't know I was sick. Plus we were high, we weren't paying attention to any symptoms or our bodies. And so I woke up one day with like a lobster claw for a hand, and my arm was just freezing, but I can't feel any of that, right? And so we went to the hospital, and I was admitted to the inpatient in Fargo, Sanford, and had to receive IV antibiotics 4 times a day. And they did 5 surgeries to like suck out all the ick. And I was able to, save my arm. And I can still use my arm. I have limited use, like I can't you know, that's as high as it goes, because I don't have any bone here, but I can do this and reach a little bit, and so I wear my sympathy sling. I'm kidding, that's what my ex calls it, because I typically don't have it on, I just have it on, or I have like a sling bag and put my arm in that, you know, I've got a lot of little tricks now, it's been 5 years, you know, and there's no pain, so I'm really grateful for that. But here my visual aid is I actually had to call my ex the other day and get my pictures, because he saves everything, that bigger. That's my, after the surgery, you know, I mentioned how the swelling and stuff can be in your arm. And so after the surgery, they wrapped my hand in this bandage thing, and then after they took it off, this is what it looked like, because the swelling had gone down. And I haven't seen these pictures in a long time. But, and then this is one of, after the surgeries, I had to have this thing in my arm to kind of keep the wound open until it could heal from the inside out. And it looks worse than it was, I guess, or I just downplayed a little bit. What was that? Okay. So anyways, you know, we ended up going to Sioux Falls to continue the antibiotic treatment outpatient, so I didn't have to stay in the hospital anymore. It was 3 weeks, and anybody who knows me, and that's a long time for me to sit in one place and have to listen. But we stayed in a homeless shelter, and my husband got a job, and you know, things started to seem normal again, but the underlying issues of that, you know, substance abuse, emotional and mental health were still there. We were both pretty freaked out, you know. So sometimes, like I said, I don't know, I can really, if I don't watch my attitude, I can start to feel like a victim. Poor me, my arm, oh my God. Well, you know, there's people that make it through life with no arm. At least I still have the thing. And so I'm technically disabled. I do receive disability now. It took about 3 years to get that. I have a steering wheel assisted driving device. This is pretty cool. I've had it for about 4 months. You know, it's nice. I have handicap parking that I milk sometimes, like if I'm at Walmart. But typically it's just because I can't carry things a long way, you know, I have all my bags and stuff like that. So again, I've learned some tricks to take care of myself that way. Today I'm still in a little bit of denial about what I can and can't do, like I did a bunch of shoveling. I should not probably do that, but it doesn't hurt, right? But it tends to feel heavy and stuff after a day of shoveling. So mainly I guess that to end it up here is, you know, I wasn't taking care of myself. I wasn't grateful for anything. I was off doing my own thing because of my mental and emotional health. You know, I'm married to a drug addict. I was a drug addict. I had 11 years off meth when I relapsed, you know. And so there's that, you just go downhill emotionally, and so then you use more to not feel, and then you feel bad for using, you know, stuff like that. There's a few of us that know what I'm talking about. So today I try to, you know, make sure I look at my body every now and then, you know, if I'm feeling weird, I have to do this, make sure there's nothing there in the mirror. Slow down, you know, I pray constantly. I go to a ton of meetings and support groups. I'm in counseling, you know, I have regular physical checkups with a doctor. They're not going to fix my arm. I've had 4 surgeons say that there's really nothing left to attach anything to. So I just have to be, like I said again, grateful for all that I have, how many chances I've gotten, you know, in life when other people use a couple times and die, you know, or to not know that it was happening. And thank God it doesn't hurt. I would be the biggest baby. I mean, if I was in pain constantly, I'd be like, you know, I just am not good with that. So in the end, and then I just wanted to add this one because I love them. Things that helped me stay positive today, also when you did your positive affirmation speech, that was awesome, and your, you know, the trauma generational stuff just clicked for me. So yeah, I try to help others. I'm volunteering at Soup Cafe next week because I don't like that many days off. You know, I don't do well with unstructured stuff. But also part of my therapy is these guys. Yeah, my kitties.